Hello there. Welcome to another episode of Rare Diseases, a podcast run by Rare Disease Review Western, a student-run non-for-profit organization that aims to translate complex rare disease research into easy-to-digest articles. Rare Disease Review Western is also very active in initiatives that support and advocate for rare disease patients and caregivers, such as this podcast. My name is Anusha Merchant, and I am joined by my co-host, Omar Abdulrahim. Omar and I are both co-vice presidents of external events with Rare Disease Review Western. Welcome, Omar.
Thank you so much, Nusha. It's a pleasure to be here today.
Awesome. Thanks, Omar. So today we are going to welcome our guest, Lori Verton, the president of Arachnoiditis and Chronic Meningitis Collaborative Research Network, abbreviated as ACMCRN, and a former clinical research associate. The ACMCRN is a nonprofit organization established in Canada in 2018 and has since been a key stakeholder and support for patients of the rare disease arachnoiditis. Lori will be speaking to us today about arachnoiditis, her experience as a patient, and the incredible organization she has helped to form. Lori, it's a pleasure to have you on the podcast today.
Thank you for inviting me. I'm glad to be here.
Amazing. So to get us started, Lori, can you help us just by getting started off with introducing yourself to our audience and telling us a little bit about yourself, your interests, and also your journey with arachnoiditis?
Absolutely. So, again, my name is Lori Verton, and I'm the president of what we call ACMCRN. I'm also a patient with arachnoiditis and co-founded the nonprofit in 2018 alongside a well-known researcher within our community, Dr. Terry Lewis, who has unfortunately passed, and Louise Carbonneau, another long-time arachnoiditis patient herself, who was and is still considered an elder in the community. I would say she's been active in peer support from the time that I met her back in 2008. So we started out. I guess I should start out maybe telling you about arachnoiditis, which is a spinal cord in canal. So not the cord itself, but the canal and the spinal nerves inflammatory disease, and it is progressive, causes significant neuropathic, mostly neuropathic, but also myofascial pain, and can turn into autoimmune type sequelae. Most of our patients progress, although there's no evidence yet about progressing, but I myself have progressed significantly over the about 25 years that I've had it, and currently work from my bed, as do 4 out of 5 of our board members. For my journey, I'll just tell you how I got arachnoiditis. Arachnoiditis itself is an inflammation and adhesions in the spinal nerves, which start to essentially tether the spinal nerves into part of the system that looks after your muscle movements and your sensations. And it always requires an initiating event. I'll tell you a little bit more about the events that can do this in a few minutes, but I'll just tell you my own event. So in 2000, so we're 2024, yeah, about that, my young son was 2 years old, and I came home from working. At that point, we had owned a newspaper, and I came home from working at about close to 11 o'clock, and my babysitter said, "You are out of milk, you've got to go get some." So I jumped in the car, ran through sort of our rural area that we live to go to the small town store where I could get it. And on the way back, I managed to hit a deer, and I hit it badly and messed up the front of the car. And immediately, well, within the next day, began to have symptoms. Now, we know that some initiating events usually require can require more than one. It can require like two sort of unfortunate things, one after the other, happening in your spine. And this was my case. So over the first year or two, it was so bad with the pain in my neck and so on that I couldn't lift my head, I couldn't do my duties and that sort of thing. And eventually they decided that they would try to do a spinal tap for me, to see whether they could see if there was some form of an infectious meningitis or something going on. And unfortunately, that spinal tap was botched. And immediately before I even left the table, I had my thigh tingling and my left foot's beginning to do a foot drop, and started over the next day or two with some incontinence. Back then, they had no idea what to do with this. I went back knowing it was not the right sort of thing to be happening. And at the time, they did an MRI and they said, you have bruised some spinal nerves. And it was just left at that. And honestly, we haven't come very far in the last 25 years, except for now we have an emergency starting protocol that seems to work, but has no evidence about it yet. So I'll talk to you about that sort of thing later. So that's how I started. My interest, I'm a grandma. I'm a grandma now to five grandchildren, and we have five children ourselves overall. We're a Brady Bunch family, two of his, two of mine, and then one son together. And so at the time that I was hurt, I was working as a clinical research associate at Queen's University in respirology. And prior to that, we had also had some small businesses and in newspaper writing and marketing, which I think later on gave me the skills sort of to begin the work that I now do in the nonprofit.
It's fantastic to hear, a little bit more about, yourself and kind of where you've come from and like your journey with arachnoiditis and how it kind of started you on this path. It's definitely quite an interesting story from, I guess, the start to now the present day, and kind of learning more about how, your struggles in the healthcare system kind of was a bit of the catalyst for the founding of the organization, the context that you have now within the arachnoiditis community. So it's really incredible to to see your resilience and your strength, and the fact that you're still um, you know making the most out of this sort of situation.
Thank you. Oh, that's really nice of you to say. Thank you. I think it was almost a natural outgrowth of my experience, that sort of brought it to where we started the nonprofit when we decided in 2017 and incorporated in 2018. So what I would say is I as as most rare disease patients find out, there is a long diagnostic journey that we go through. And I've heard it over and over again from so many people. Because arachnoiditis itself is a rare disease, and most doctors um, don't know it, have never seen it. My own doctor says he doesn't think he'll ever see another patient with arachnoiditis. I beg to differ. I think he's going to see a lot of them. But because of that, I was bounced and from diagnosis to diagnosis. At one point, they decided that I had psoriatic arthritis and put me on a number of medications that, of course, didn't work. And then decided, well, if it's not that it's fibromyalgia, because it's a widespread pain condition, which is very similar to what this is. And then, of course, you start into well, maybe it's mental illness. And I hear this so many times from so many people that at some point they get a diagnosis of depression or something similar to that. Because if you go 7 years and you're in pain and you're trying to work and you're trying to keep up your family and you look reasonably normal from the outside, then I think it's hard for doctors and for people to believe that you are as sick as you say you are. And that part of the diagnostic odyssey is so debilitating and so traumatic. I think I would say that most people with rare disease, including myself with arachnoiditis, have this. So I was, misdiagnosed over and over again. As I went along in the first few years, I had to fight my disability insurer because I couldn't work any longer. I was right in my mind at the pinnacle of my career. I had just been sort of put up to had my own lab given to me. They'd only had one before and they duplicated it so that I could run my own studies and that sort of thing. And was just had sort of hit my highest amount of money that I'd ever made and was traveling the world doing it. So I was really finding my groove. And during that time, I had the pains and I had the difficulties. The first, say, 7 years before I was diagnosed was really difficult. We had 3 years where we didn't have my pay come in, and the insurer, of course, the insurer wouldn't pay. And we nearly lost our house. We had times when the hydro was shut off. It was absolutely unbearable. When I finally won that and had time sort of to sit and look around me, I realized that the story was the same. I mean, people were that I talked to in support groups. And when I say support groups, we started back then on email digest. This was before Yahoo groups. This was before Facebooks. There was an email digest that pretty much everybody went on. And so back in 2008, that's where I got all of my information and realized very quickly on that there's literally no evidence to even create a good diagnostic standard. There was no idea about the incidence or prevalence of arachnoiditis. There's no treatment. There still remains no treatment. There's no cure. And no one was doing anything. It was as if, other than a few neurosurgeons and a few case studies, there was no movement forward on finding treatments or finding cures or doing anything for the masses of people that I was hearing from and talking to every day that were living in their beds, that were um, so in so much pain, that they, couldn't get out, couldn't shower themselves, all of the things there. This can be a really catastrophic disease experience for people. And I kept thinking, what it is, why don't, as a clinical researcher, why can't we research this? Like, I just don't understand. And then one day, I was watching television, as most of us ended up doing, because there wasn't at the time a lot to be done. And I realized they did a post on someone who was a comedian in Toronto, and she was raising money for her rare disease. And I thought, wait a second, she's raising money for rare disease. And in fact, she was raising money for rare disease research. So I thought, wait a second, what? There's people doing rare disease research? Like, who are these people and what are they doing? And so I followed, the tidbits, found out who she was, traced her back, got a hold of her. She told me about a Dr. William Stanford, or Bill Stanford in Ottawa, who was really sweet to help me and sort of guide me into what is an entire sector of rare disease research, advocacy groups, groups that could teach how to set up nonprofits, how we could begin to do peer support for people, and eventually how, as you went through a lot of their resources, you got to a point where they could even teach how to set up research in rare disease. And so I took all of those courses as I went on, thinking, okay, there's got to be a way that we can implement some of our own research. We have all of these people that I'm speaking to every day. I know there's at least, in one group, reportedly 8,000 people. And to me, it was beyond me why we couldn't do something in this era now that we have virtual software to be able to do that sort of thing. And after a bit of time, I learned that there's through Beacon is one. It used to be called Find a Cure, Eurodis, Nord, Global Genes, all of these big advocacy organizations had the courses and the opportunities and the programs to learn how this new, it's fairly new, this new idea for research is being done. And to me, takes the old academic institution, the white pillars, and all of that out of the equation, and puts essentially researchers and anyone with that kind of experience um, with the right tools on par to be able to get the same high quality evidence that is needed to come up with and answer some of the questions that are outstanding, including things like I just said, what's the best gold standard for clinical diagnosis? Is there any treatments that are more effective? What can we expect for progression? What's the incident? What's the prevalence? All of those sorts of things. So I guess that's kind of how I walked into it. And it just happened that by nature, by what I've done in the past, having run a newspaper, um, and understanding a bit about marketing and understanding how to tell stories and get people involved and engaged, it just happened that it was sort of right in my right niche, and it just came naturally.
Yeah, thank you so much, Lori. It was really nice to kind of hear about your story with arachnoiditis, and I can imagine that it's just been quite the battle that you've gone through with, first even receiving that diagnosis of arachnoiditis, a disease that isn't easily recognized by many physicians. And then once, you receive that diagnosis, then having to navigate, the other things that come with it, like job loss, with your family when you were the primary breadwinner. So I can imagine it must have been a really frustrating and difficult time. And it's really incredible to hear your story about how you've kind of collaborated with so many people and how you've come across the field of rare disease research and, the work that you've been doing by talking to people along the way, such as other rare disease patients, advocates, doctors, and with the organization that we talked about a little bit earlier with ACMCRN, you've done quite a bit of work and expanded, this field of rare disease research. So I was wondering if we could kind of dive in a little bit more into that. Um, so over the years, it's been really clear from your social media presence that your contributions to research and podcasts that you're very active in the rare disease community and a vocal advocate of arachnoiditis. But with that in mind, how do you believe that your guidance has helped the organization evolve to where it is today?
Honestly, it has been teamwork. It has been patients helping patients. It has evolved organically, I think. So we've had previous attempts in the arachnoiditis community to move forward with different organizations and so on. And unfortunately, as these things happen, in larger communities, trying to all, there's personality conflicts and that sort of thing. And I had seen so many initiatives fail that had started out strong, that looked like it was going to go somewhere, and then ended up because of, I don't want to say petty arguments, but conflicts that probably could have been handled differently. And, we're getting like two sides in the community. I'm on this side or I'm at that side. There was one point where if you were in the Yahoo groups, if you were in one Yahoo group, you couldn't let the other Yahoo group know that you were in there because the one moderator didn't like the other moderator and all that. And to me, it just felt like this is ridiculous. This is not, we're going to go in circles doing this. So when I designed or thought about ACMCRN, I had read about collaborative research networks, and I really felt like this has to be a sort of an umbrella group that leads a vision, leads and gathers everyone of the stakeholders that might be interested in the end goal of helping people with arachnoiditis live better lives, to invite them in at whatever level or whatever project or whatever proposal they had, and do what we could with our resources at whatever time that they approached us to assist them in bringing that forward, building that up, and making sure that uh, the entire work team understood that this is one team effort, that we're all going the same way, that we leave our personal political differences, religious differences, everything, at the door, and we come in working as a team, patients helping patients. And I think that that way of having sort of an umbrella where you say, yes, we have three main program areas. So we have peer support, which is of course, patients helping patients who've experienced and lived through many of years of this, giving their wisdom to others that are just new to the community and new to arachnoiditis. Education, that's for both physicians and healthcare providers and patients. And the third thing is our research arm. And for me, of course, because that's where I came from, research arm was my priority and has been. And honestly, pretty much every time I've had a wish, someone has come up and answered it. And it's just, seriously, there's so much power in community. Like, they say arachnoiditis is rare. We believe that through our research and through our own experience that arachnoiditis, in fact, is not rare. It's just rarely diagnosed. Each time that we've needed to build something, we've either looked within our own community or gone to the networks that lie alongside of everyone. So, I would say, well, does anyone know a lawyer? I need, some legal advice. Who has a lawyer? And there may not have been a lawyer in the group, but I'd go on a LinkedIn and I would see that one of the other persons had a lawyer on theirs, and they would let me network in with them and then reach out to the lawyer and get help that way. And honestly, I found that by just asking for help in the right amount and being very specific, we've been able to grow the network and evolve as far as we've gone. And we've just, like I said, finished our first study. The data collection was done by 2022. The poster abstract was out and started being shown, submitted and shown at a number of conferences, rare disease, neurological sort of pain conferences. And now we are actually at the point that we are in final drafts of a manuscript for submission. Now, I've been so lucky because the research team has, again, organically grown. Once I put my faith that Dr. Terry Lewis and we started this survey on the Stuff That Works platform, and I just had the faith that if we just got the data to start with, we could prove that this idea would work, that you could do rare disease research on the internet, quickly recruit people, consent them, have decent data, and come up with some real results, which we were successful at. And so that paper actually is called Harnessing AI and Machine Learning Platforms in Rare Disease, and then the subtitle Living with Arachnoiditis. The term collaborative research network is actually a new term that's being used quite often in the rare disease literature now, as are patient registries. And so through the collaboration of many others, of people, and now we're getting external researchers coming to begin to do their own research using our patient registry and our platform. Because so now what we can do is collaborate with, for example, arachnoiditis seems to have an association with some specific diseases. Ehlers-Danlos, we see a higher than we would think association, number of people with Ehlers-Danlos. We see a lot of people, and we know that arachnoiditis quite often sits alongside Tarlov cysts, as well as CSF leak. And so all of those sort of syndromes or diseases have their own groups, their own nonprofit groups. And what we're trying to do, and it seems to be beginning to be quite successful, is inviting those researchers, the specialties in EDS or Tarlov or CSF leak, to come with us and create combined studies so that we can access not just their patients, but their patients and our patients together on a platform, so that we can start to look at more specific groups. the peer, PEER, patients engaging each other responsibly. And essentially, we're just all small rare disease groups. Mine's arachnoiditis. There would be, another one in Wilson's disease. There'd be another one in, whatever, PXE, that sort of thing. Each of us decided to go together in this peer group. We went back through and assessed all the platforms that are out there on the market right now that we could decide to bring our studies to, but we all have about the same sort of agreements on what's important to people in rare disease, like the actual patients, what's important to them. We don't want to go from what the physician wants to know, but what the patient wants to have fixed, or what the patient wants to know, and move up from there. But none of this could be done, could have done by myself, not like alone. All of this was me learning on top of others who've come before, who've written and told what that works. Rare disease individually, is rare. The fact that arachnoiditis, it's not like diabetes or asthma. There's certainly not, just every other person has it. So it is rare, but individually we're rare, but collectively we're not. There's over 8,000 rare diseases. And, many of them have no treatments, no advocacy or groups or that sort of thing. So there's all these other groups that need the same thing done. But I believe that the statistic is somewhere around 300 million people worldwide live with a rare disease. So, individually, we are rare. Collectively, there's a lot of us. And so when we worked together at that level, when I say the advocacy level, I mean the larger allied groups like NORD, like Genetic Alliance, like Global Genes, and so on. They've learned best practices. They've done their own studies in how to do rare disease. Now there's new papers just recently coming out on best use for the actual rare disease platforms that we're working on. So individually, I wouldn't ever, if someone said to me, how do you become this? How do you do this? I would say there's no course you could take. There's nothing but life experience that could put you in the place that I am right now. And only because I only stand here with my group underneath me on the shoulders of all those with rare diseases across the world that have come before.
Yeah, that was a very powerful answer, Lori. Thank you so much for, giving us a little, I guess, insight into, um, I guess, how the organization evolved through the rare disease community and sort of the joint advocacy of all the different voices that are in the community. And also, it was awesome that you touched on, the fact that in the rare disease space, research has to be, both involving the community, but also is taking, information, resources, and experts from the community and sort of creating, as you said, this collaborative research network to, create all these platforms and programs and, research studies and projects that the ACMCRN is working towards. So that's awesome. I guess continuing our discussion about research and kind of, honing in on a specific study. I know your group published an abstract and poster in 2023 that surveyed 1,250 patients with arachnoiditis. I think you mentioned this a little bit earlier. And I will add, like 1,250 patients, like that's a pretty large sample size for, a rare disease research study. And we were wondering then, I guess, like, would you be able to describe to us the work that went into the study, the findings that were uncovered, how these findings, benefited the rare disease community, and maybe like touching a little bit on the use of AI in that study?
The development of that study actually was pretty simple. At that point, Dr. Lewis and I, who I've said has since passed, just really wanted to see whether or not we could recruit enough people using the methods that we had on hands, which is essentially social media, word of mouth. I mean, very few. We sent out things to doctors, but I don't think we saw anything come through that way. And so we were just really looking at, will this work? And it's essentially designed the same way as any study, a research study, clinical research study would be designed in an academic situation. I mean, you have the same requirements about GCP, good clinical practice. You still have to have IRB approval. That's your ethics board approval. You still have to have all the same interest, design, understanding of the consent process. The data gathering is very similar. The only difference is that you have to be very clear when you're gathering your data, because I would say you have to interrogate more because you don't have someone sitting in front of you. Whereas in the past, when I was a researcher, of course, as I'm going through a study, there would be times when I could clarify something that they just didn't understand about the question. In this situation, when you're doing it virtually, the participants are coming in on their own time, registering on their own time, and doing their study on their answering the questions on their own time. And even to somewhat today, it's really just the Excel, the database spreadsheets and that sort of thing, and then doing statistical analysis, looking for patterns and that sort of thing. The difference with rare disease research that employs AI and machine learning is that there's algorithms in the background that can pick up trends and patterns much quicker. Now, even when the AI or the machine learning, however you want to put it, depending on what portion of it's working, when it comes out with its findings, or they're called insights, that we had, the way it was coming out, we used to come out as insights, you still have to go back into it just like you did in the old days and take a look at the actual data and make sure, do all your all your cleaning up, all your statistics, whether it's all your, if you have to do regression, whatever you have to do, you have to do it the same way. But the interesting thing is that the AI brings out patterns that we would never have, I don't think, seen prior to that. Our study looked at things like aggravating conditions. We had people report on, and there were suggested fields that were already given, and then there were open text fields so that people could add whatever they wanted. So we did like symptoms. Of course, we did the typical demographics and all that sort of thing. But then, we did symptoms. We asked them about their treatments and how effective they were. We asked them about which treatments weren't effective. We asked them which ones seemed like after a certain either a treatment or an intervention, which ones seemed to aggravate or incite their arachnoiditis. And then after we had, the treatments and all that sort of thing, the research team went through all of the data and came out with our tables and so on, so that we could say, which treatments are seen more effective or less effective, giving us sort of a broad idea. For example, some of the things that we found is that none of the treatments that anyone tried ever exceeded more than about a 30% rate for positivity, saying that like there's no treatment out there that anyone is like happy with. 30% happiness is like the top end, like of all the treatments that we've been having. So these sort of insights came out of the sort of the old-fashioned type of research, where these are the questions about, specifically set up aggravating aggravating your original trigger, your activity levels, that all that sort of thing. And it came out, and we can now, I guess I would say, it set us up really well. The results of that study set us up really well for future studies, for giving us an idea of where we really need to hone in first, to get a better idea of what mechanisms or interventions we could then try. So we've got now from that a fairly good idea of our next 3 to 5 studies, I would say, and depending on what each of those say, we'll learn more. One of the studies, one thing that came out that the AI found that I swear we wouldn't have, we couldn't have found. So the platform that we used at the time had the opportunity to take all of the participants of all the diseases, the entire huge database, and I believe it's over 1,100,000 at the time, participants or data points of people coming in, because that platform took everything. It took, everything from diabetes to asthma to, kidney disease, like everything under the sun. And they have a score called the CC score. It's their own proprietary algorithm that would looked at in our group, arachnoiditis group. Is there anything unusual about our group that seems to be significant compared to all the other diseases out there? And in fact, we found that our disease, arachnoiditis, has the complaint, a patient complaining the primary symptom or one of the primary symptoms of having difficulty sitting. And that difficulty sitting was correlated or showed up more often only in Charlot cyst, which happens to be an associated condition with ours. Charlot cyst, second only to arachnoiditis. So that's kind of a marker that we have to go look at. Like, could we add this to the diagnosis, the diagnostic criteria, or at least something to show this is, if you've got this, you need to take a look, consider arachnoiditis as a possibility. And so I don't think, and I know, how would we have ever compared that ourselves without the AI, without that technology and those algorithms? We would not have gotten that out. So that's where I find that these digital platforms and the software that can be used on them are going to make leaps and bounds, honestly, for rare disease research overall. And I think possibly for better outcomes for different rare disease groups, certainly for ours.
Yeah, that was a wonderful answer. I have to say, I think it's pretty cool to learn about how you were able to use machine learning and AI to identify these patterns, within the research results, and then obviously supplement that by going back yourselves and just making sure that you're checking it all. But with technology advancing so much, it's pretty wonderful to hear like how it's been directly benefiting rare disease research and allowing you to discover more within this field. And I'm excited to see, where the field of research goes with even more advancing technology in the future. But also shifting gears a little bit and looking kind of beyond the research aspect of ACMCRN. You've also touched on things like the peer groups within ACMCRN, and I was wondering if you could talk a little bit more about some of the resources and the supports that are available to patients and caregivers through the organization.
So to start with, our peer support areas have grown from, like I said, originally, before ACMCRN was involved. The idea is first it was email digests, then it became Yahoo groups, and then when Facebook became popular, it became, I would say, especially we're finding with a specific demographic, it seemed to be very popular. So we have two dedicated Facebook groups. One is a public-facing one for education, new research, interesting, associated articles and that sort of thing, where we ask our members not to post anything that they wouldn't want to see the whole world to see. And then we have a separate private Facebook group that is where everyone can go in and talk about, whatever. This is happening to me, I'm so depressed, or I've heard about this supplement, what do you think about it, and that sort of thing. I think that, and I don't know if you'd find it everywhere, but I certainly absolutely have found it in our community, that people want to help people. People that have suffered and have found anything to help really want to help people. And if they can't help another person, then with their own experiences or their own knowledge, then they'll do their best to just encourage them. So along with peer support, we have a very comprehensive website that we've been very careful to keep up with the latest resources. We have a summary toolbox where people can go and just learn, rather than the huge website that's searchable, and there's so many different, there's a blog, there's a forum, there's a newsletter, there's the basic information pages, there's external files. Rather than there's a one big source. We also have a learning toolbox link that has more of the most important things, which includes the different groups, social media groups that we have. So we now have we have two on Facebook, and we're associated with pretty much all of the arachnoiditis Facebook groups. So we've gone to all the moderators and admins there, and we're either co-moderators or we we've been allowed to post whatever we want from our group into their groups, so that we can keep the whole community at large invited. We also have just opened a LinkedIn discussion group, more for professionals, that, medical doctors and interventionists and neurologists and neurosurgeons that are interested in that sort of thing, as well as if people want to come in and ask questions of those people, they can do that. We just opened, although it's really new and we're just learning how to use it right now, a WhatsApp group um, on specifically trying to break down into rooms for people with the two diseases, so arachnoiditis and Ehlers-Danlos, or arachnoiditis and CSF leak, or arachnoiditis and Tarlov cyst, so that there's a little area where people are experiencing some unusual, because there are patterns within that. There's patterns within those three groups that you could see, that now from an outside I could say, yeah, that's that in EDS, that's that in CSF leak. And so we're trying to hone that in so that people can, fit themselves a bit more within each, to get more specific solutions and that sort of thing. We also have had all along, and we're just revamping right now, a peer support Zoom meetings. And this is one of the ways where a group that had been previously created came with us when we were talking about other things and said, we don't seem to have enough people and enough money to keep the Zoom meetings going. Can you help us out? So we added it to our event calendars. We created a position in ACMCRN for a men's support group leader, knowing that they had already women's support group. And our men's support group has been going fantastically now for over 4 years. And really, really popular with the men. And then we have the newsletters that go out, as well as, the typical social media stuff, like the short video reels and all of that. So those are short educational video reels that we often post. Like we just posted, arachnoiditis and exercise and different things like that.
Yeah, that's fantastic. Thank you for detailing a bit about like the different kinds of support resources that, the organization offers. Like, I think that something that I noticed when you were, speaking about all the different, avenues of support that you offer to patients, whether that be education or peer support or what have you. You were trying to take as like all of these different options that are available and like try to put them to use and try to maximize them. And I think that's so important because you're kind of catering to everyone and everyone's needs, and you're really being cognizant about what kinds of information people need, what kinds of support people need, and really, again, going back to that idea of community and really focusing on, the needs of, these different patients and I guess how to best help them in their situation. So that's fantastic. And I think that actually ties into Arachnoiditis Awareness Month, which has happened this past July. So it's only a week ago now from the time of this recording, and it looks like each year the ACMCRN puts a lot of effort into raising awareness for arachnoiditis during July. And so we were wondering then, how is this special month celebrated? And could you walk us through, a typical roster of initiatives that the ACMCRN would feature during July?
Sure. July is our big month. I mean, there's Rare Disease Day in February that we always make sure that we have presentation for that night or for that day, as well as a lot of like awareness activities. But July is our big month, and it takes a lot of preparation. Typically speaking, we put out a newsletter. Now we have quarterly newsletters that always sort of update everyone on where we are, like what we're doing, what our initiatives are, how they're moving forward, maybe what we need, and then other like new articles or other things of interest. July, we put out a special one for that specifically. We then typically have one presentation by myself, a webinar where we create a presentation and I update everyone as to what what's going on in the community, what we've learned about, in the past year or the past 6 months, how our initiatives are moving on, anything that we've learned from other groups or other doctors or something. If there's, something that we can share of, occupational therapy tools or something like that, then we do that. So we have the newsletter, and then we have a webinar with myself. Sometimes we have, depending on where we're at, we'll have a special research presentation specifically for the people that are more interested in the research and the nitty-gritty of research and where we're at with that. And then we do a lot of small videos, short videos, some of them that have been done even a year or two ago, but are replayed information, usually 30 to 60 seconds long, that provides people with basic education about what arachnoiditis is, what its symptoms are, what its prognosis is, and the resources and other things that are available to people, how they can, speak to their doctor to get tested, just that general sort of thing. So we'll have some, like we do it on all channels. So we do it on LinkedIn, we do it on, we do it on LinkedIn, we do it on Facebook, we do it, on Instagram, we do it everywhere that we can. And we have a number of them. The VP Patient Engagement, Eve Blackburn, works with her team, and they've created a number of new graphics. Typically, we set out one or two new graphics on. We have merchandising. So we have an ACMCRN My Shopify store. And each year we try to put out one or two new graphics for that. And sometimes we'll add in special peer. This year we couldn't, but we will have the peer support groups. We'll have more of them, or I will go in as a guest on someone else's channel, and then people can ask me questions and that sort of thing. There's a lot of thought put into it. It's a big blast. The idea is to reach, not just arachnoiditis patients, but really anyone who has the symptoms and can at least say to their doctor, hey, can you check this out, because these symptoms are the same. Can we add this? We would say, to our differential diagnosis, but they wouldn't say that. It's can you just take a look and see what this is? And so we're working as hard as we can to get as much information as we can out to cut that diagnostic odyssey time, the time from when they recognize their symptoms to they actually get a real diagnosis, so that there's not all of the pitfalls that are in between. I mean, there's so much trauma that happens in the portion of time between the really significant symptoms occurring that are essentially wrecking your life, changing your life completely, and the time when you get here is the diagnosis. The diagnosis for people makes such a difference, because when you have your diagnosis, you have your plan. All right, now I can go and get the information that I need, because I can go to that association, or to, you can have somewhere to start. And so it's always our prime goal in July to spread the message as far and wide as we can, to get as many people to at least think about arachnoiditis, and hopefully save some people from, a longer time without having a diagnosis.
Yeah, and that's an incredible mission, that guides Arachnoiditis Awareness Month. So it's really cool to, get it like deep dive into, what you actually do to advocate for arachnoiditis during July.
And then also, before we wrap up our episode today, Laura, we've had such an amazing discussion with you, talking about arachnoiditis, your personal journey with it, as well as the amazing work that you've been doing with ACMCRN. So before we end off the episode, I was just wondering if you had any final words that you wanted to share with us and our audience, before we bring a close to our episode.
Well, I'd like to take this opportunity to once again tell people about the symptoms of arachnoiditis, because I believe there's a lot of people that have had experiences and are right now living with symptoms of arachnoiditis and don't know it. So what we'd like to say is, if you have lower back and leg pain, either in one or both legs, if you have strange sensations like burning feelings like spiders crawling. We have electric jolts. Uh, we call bee stings, where you have a part of your skin, or for me, it's my toes that will feel like they're being stung by bees. Electric shocks, those strange and unusual symptoms, they're called paresthesias. If you have um, difficulty sitting, which was something we've just recently found, if you find difficulty to tolerate sitting, and if you've ever had any sort of intervention on your back or your spine, or if you have had any sort of infectious disease like a infectious meningitis, or a viral, like a viral or bacterial meningitis, um, it can be a risk factor and a sign for you to go and take a look with your doctor. With regards to the initiating factors, so we don't know why some people get arachnoiditis and other people don't, or some people do and other people don't. But we do know that commonly they have an initiating factor. Mine was that spinal tap after a car accident. They have either a back surgery, one or many, and it can be, now when I'm talking about lumbar arachnoiditis. There are actually 5 other types, but the most common is lumbar, and the only one that would probably have the symptoms that people would recognize would be the lumbar. So if you've had an epidural for having a baby, you need to look at that. If you've had, and symptoms can come up to 10 to 15 years later. Some people, like me, it's right away. Other people, it'll be years on before it really sets in, because it's a scarring of the nerve roots, and it takes time for that scarring to get bad enough to cause problems and cause enough symptoms for people to be uncomfortable. So if you've had back surgery, if you've had the back pain needles, a lot of doctors will say, oh, you've got back pain, we're going to give you a needle, it'll be good for 3 months. They're called epidural steroid injections. If you've had those, if you've had a spinal tap like I have, if you've had any sort of intervention in your spine, and you've had long lasting back and leg pain, if you've have typically burning feet, um, not so much the legs, but burning feet, if you have those strange sensations like I was just talking about, and if difficulty sitting rings a bell with you, then together you probably are a candidate for having arachnoiditis put in to your doctor as a possibility. Unfortunately, a lot of doctors don't know what arachnoiditis are. A lot will send you, the standard right now has been to be sent for an MRI with contrast, but recent studies show that 60% of the radiologists miss it. So that's why we're working on more things. But right now we're beginning to believe, and the papers that are out there beginning to say that the symptoms and presentation are the way you diagnose. So if you have those symptoms and you've had that past history, you're up against, people saying, maybe they say it's fibromyalgia, but it's progressing, because fibromyalgia is not supposed to progress to like leg weakness, because quite often you'll start having difficulty standing or walking. You may be able to move your legs, but you won't necessarily have the same control over them as you've had in the past. All of those things point to a possibility of arachnoiditis, and it should be something that you should speak to your doctor about. And if your doctor doesn't know about it, he can come in to our website, take a look at our physician information. They are welcome to write me directly. My email is there, as well as Dr. Linda Babasito, who is our research team lead. Her emails are her links are there. And we are very open to answering questions for people. So anyone who thinks this sounds like something and they're wanting to ask questions, come to our website, come to our social media groups, join in, talk to people, and I'm sure you'll find some help and ways to figure out whether this is your problem or not.
Yeah, those were great words to end off, the podcast episode on, because It ties back into, our earlier discussion about, what arachnoiditis is, how it impacts patients and, kind of the, disease, diagnosis and disease and diagnostic odyssey, process. And so, I think this is a really important message for individuals to be hearing and, just in case anyone is, going through, this sort of journey as well, like this is gonna really help them as well. So I really appreciate that reminder, Lori.
Thank you. Thank you so much.
Of course. And well, there you have it. What a fantastic discussion today we had with Lori. We really appreciate you taking the time today to speak with us about arachnoiditis and the impact that the ACMCRN is having in the rare disease community. Thank you so much for all your incredible insight and wonderful discussion today.
Thank you very much. Thank you for having me, and good luck with your podcast.
Of course, thank you so much, Lori. And well, stay tuned for our next episode by subscribing to the Rare Diseases Podcast YouTube channel or following Rare Diseases Podcast on Spotify. That's three words, Rare Diseases Podcast. RAREDISEASES Check out the description of this episode for the link to the Rare Disease Review Medical Journal and our social media pages. This is Rare Disease Review Western and Lori signing off.